Hello everyone, I'm John Evans. Welcome to another episode of One-on-One. And with the coronavirus being top of mind, we decided to take a little different track with this new episode of the podcast. We've brought in some experts to try to get the difference between fact and fiction, get questioned, answered when it comes to something that is top of mind for millions of people all across the United States. Joining me in the studio is Lisa Brown. Lisa is the Public Health Preparedness Coordinator for New Hanover County. Lisa, we appreciate you coming in. Thanks.
Thanks.
And we also have Carla Turner with us. Carla is the Personal Health Services Manager with New Hanover County's Public Health Department. Carla, thanks for coming in.
Appreciate having the opportunity, John. Thank you.
What is going on today, and as we sit here and we tape today, the World Health Organization has just classified this as a global pandemic. And I think that's important to say global because it is literally all around the world. Can you compare this to what most people are familiar with, and that's a flu virus?
Sure. So this is something actually that we do plan for, usually in context of a flu virus, that would maybe mutate and that there would be lower herd immunity to, and that we might not necessarily have a vaccine for immediately.
Okay.
So that's something that for planning purposes, public health and those organizations are already familiar with. What we're seeing with COVID-19, so we back up just a bit. It's a coronavirus, and there are many coronaviruses. There are currently 7 known to make people sick. This is just the most newly discovered coronavirus, which is why you might have heard people refer to it as a novel corona. That means new.
Okay.
So globally, what we've seen is that about 80% of cases seem to generally be mild. You might have symptoms that sort of mimic the flu in some ways, fever, cough,
respiratory type symptoms. Yes.
Respiratory symptoms. And the concern and why you hear so many public health messages right now is that what seems to be the case is that those that are older, they're saying 65 and above, or those that have chronic underlying health conditions and don't necessarily need to be older. That would be children as well.
Diabetes, heart disease, some
lung
of those
disease,
kind of things,
and
lung diseases.
Also
smokers.
Not to forget also those children with special needs, special health needs, those as well.
Gotcha.
And those that would have any
immune suppression, any type of immune system, weakened immune system. You think about people who are getting chemotherapy.
Fair enough.
Yeah.
Okay. So, but in its behavior and in its genesis form, this is something similar to a flu virus then. Is that correct?
In the level of how it spreads and how easily it spreads.
Yes.
I think a comparison to the flu virus would be applicable too.
Okay.
Yeah.
And again, just trying to get all the information out there. When you're talking about the flu season this year, the CDC says there have been 34 million cases of the flu, 350,000 hospitalizations. And when you're talking about COVID-19, 118,000. So when you compare it to the flu, it is minute in the way that it is taking hold so far compared with the flu around the world, correct?
That is correct, but I would say an important distinction and part of why public health has paid so much attention to this for months now is that unlike with the flu, we don't have a vaccine and we don't have any proven therapeutics.
Medical treatments, yes.
And we don't have any herd immunity. This is new to humans. And so that is the concern, that we don't have those tools in the toolbox that we do have with flu to help slow the spread and help protect the more vulnerable populations.
And I would want to just point out with herd immunity, the concept of herd immunity is maybe there's something there's a vaccine for. You have an issue that for medical reasons you can't get the vaccine. Well, Lisa and I will get the vaccine. That way we're protected and we're not putting you at risk. So getting the community protected so that they can take care of those who don't have immunity. But like she says, with COVID-19, there is no herd immunity right now because it's a novel virus. So, but that's the importance of herd immunity, is taking care of yourself so that you're also taking care of your community and those people who cannot be vaccinated for whatever it is.
But I would say, kind of back to that comparison with the flu, is you heard a lot of that public health messaging that is very similar to what we were already saying about during flu season.
Right.
That stay home if you're sick.
Mm-hmm.
Don't go to work. Don't go to school. Don't go out in the community. That washing your hands and doing it properly.
Yeah, the prevention things,
Yes.
Those
they
don't
mirror
change. Yes.
the
They're
flu.
they're
Yes.
identical to
Yeah.
how you protect yourself during flu season. So those were already good ideas, and we're just wanting to make sure folks
Yes.
are being extra diligent now.
And keep in mind, when you're looking at the numbers comparing flu to COVID-19, flu season's been going on for a long time. Flu season in the United States in the Northern Hemisphere starts about August, September.
Right.
Flu season in the Southern Hemisphere started back before the summer. So there's been a much longer period in order to gather those numbers and that data, as opposed to coronavirus, COVID-19, which was January 2nd was when.
I think it
Well,
was
31st, I think,
yes,
the World
very
Health
end of December.
Organization got its first notification that it was in
Okay.
China. So we're talking the better part of 2 months, 2.5 months.
Right.
So anyway, how close does somebody have to be to pick up this virus? That's another one of the questions that we
Sure.
got, and we're going to go through here. These are questions that we solicited through our Facebook page. People have asked us about that I've gathered as I've been reading more information. Again, you hear a lot of things that you have to be right next to somebody, or you can get it in the same room. Give me an expert's opinion here. How close do you have to be, or can you be, to pick up COVID-19?
Well, what the CDC is saying is within 6 feet for 10 minutes.
That's what they're defining as close contact.
Close contact.
Okay.
And so that is kind of what they're pointing to say that you'd be vulnerable. Now, I'd keep in mind, so something like measles, for example, where it can
Yes.
be in the room hours after somebody has left that you walk into and you might get it. That is not what we're talking about here.
Exactly.
Okay.
Yes.
We're talking about droplets. So
Me coughing, sitting where Lisa's sitting, looking at you, coughing my head off and not covering my cough.
Gotcha.
Yes.
It would be out there, but you'd have to have that contact for a little longer extended period of time we're talking here.
I mean, it's not impossible to say that you could.
Sure.
That it's not like there's something magical about 10 minutes.
Right, understand.
This is the guidance that CDC
And that
says.
could
That's
be,
what, yes.
for somebody who's healthy, it could be, you could be in there and it take a longer period of time. Somebody in those risk areas now we're talking, it could be a much shorter period of time for them to be impacted.
I think you're thinking about it correctly.
Yes, I agree.
Okay, all right. So shaking hands. Actually, we're here seeing, and I saw you guys today. I did the elbow bump.
Yep.
People
Well
are,
done.
are stopping shaking
Yes.
hands. They're not touching doorknobs. They're not, doing things or touching things where others may be in contact. Can you pick it up by shaking someone's hand?
Yes. If I have just coughed in my hand or sneezed in my hand and I have not washed my hands appropriately, and I see you, hey John, and we shake hands, and then you rub your eye, you could potentially just expose yourself to whatever I have going on.
Okay.
So yes.
And touching of the face is the big thing that
Yes.
everybody has been talking about. Is that different than a regular flu virus, or the same thing?
It's not.
Same
It's
thing.
the same thing. And you don't
Okay.
realize how much you touch your face until
Oh,
you,
no, I
until
have.
you tell
I've
yourself you
realized
shouldn't touch your face.
the last
Yeah.
couple of days.
Yeah.
Right.
I've realized that you have an
Yeah.
itch, and all of a sudden, oh wow, I just touched my face again.
Exactly.
And you really don't realize how often that is. Is this something, the symptoms of COVID-19? I think you both talked about they're a lot like influenza symptoms. Do they come on in a heartbeat? If somebody's got a sore throat, running a fever for 3 or 4 days, should they go to the doctor, or is this something I'm feeling good in the morning and then all of a sudden early afternoon, oh, my stomach hurts, my head hurts, I'm starting to sweat. Talk to me about the symptoms.
I have not heard that they come on that quickly. You may develop a fever potentially, I guess, before you have the cold type symptoms, the upper respiratory symptoms and the cough. I don't know.
Some of these things, the information is evolving so quickly because this is so new. So I would be hesitant to say that we necessarily know across the board what that's going to look like for everybody.
Okay.
I would caution folks, though, if you're concerned, to call your
Yes.
healthcare provider. So the last thing we want, if we would have COVID-19 in our community, is that folks that were afraid they had it to go sit in a crowded healthcare office lobby or an urgent care.
An emergency department, exactly. Potentially exposing everybody else sitting in there with them.
Or potentially exposing healthcare providers if they hadn't communicated what their concerns were in advance.
Okay.
Because if we have it in the community, it's going to be very important that we keep as many healthcare providers
Healthy.
well
Yes.
and healthy as possible, because we're going to need them
Right.
to keep the rest of the community healthy. So calling ahead is really critical information that we want to get out.
That's
Carla?
a message. That's a message we definitely want people to understand. Like you said earlier, if you are sick, please do not go to work. Also, don't go to church. Don't go to Walmart. Don't go shopping. Stay home. If your children are sick, please keep them home. And if, like Lisa said, if you're not feeling well, do not just show up at your doctor's office. And that's a message we're trying to start to put out at the health department. When we do our reminder phone calls for appointments, we're saying if you're not feeling well, please call us and we can reschedule you and we can listen, kind of find out what's going on with you and give you some guidance as to what you need to do. But we do not want people just walking into Medac or the ED not feeling well.
Okay, once again, if you're just tuning in, this is kind of a special edition of the One-on-One with John Evans podcast. Lisa Brown is the New Hanover County Public Health Preparedness Coordinator. Carla Turner, the New Hanover County Public Health Personal Health Services Manager, talking about COVID-19, trying to separate fact from myth and fact from fiction. If somebody's got those symptoms, who decides, Lisa, who gets tested? Who makes that decision that, okay, I think you're going to get tested?
So there are actually there's
Okay, Carla, it looks like you got.
Well, no, I was
piece
going
of
to say
paper here.
the State Department of Public Health put out guidance yesterday evening for providers in the
Okay.
community. The health department did blast fax that to all area providers this morning, first thing this morning. It talks about who is eligible for testing. They have, I don't know if I would say relaxed the testing criteria, expanded it. They've changed it a little bit, expanded it. So there's two different criteria that you could possibly meet.
Okay.
The first would be that you I have this written down somewhere.
Okay.
Lisa, help me. There it is. Thank
Okay,
you.
perfect.
That you have fever or
Okay.
signs and symptoms, meaning cough, lower respiratory illness, shortness of breath.
Okay.
And you also have been a close contact to a confirmed case of COVID-19. So someone has had a positive test.
Okay.
So you're a close contact of that person and you have the symptoms. Then you are eligible for testing through our state public health.
Okay.
State lab public health.
And if somebody presents at a doctor's office with those kind of symptoms, can a doctor test and then send it, or do they send that patient to the health department?
They can do one of two things. They can call us and we can work with them to go collect the sample and send it to the state lab. Or if they meet the criteria, they can also choose to send it to a private lab. There are a couple private labs in the state that are now able to do the COVID-19 test.
Correct.
But the other criteria that you could meet was that you have fever and signs and symptoms of the lower respiratory and you have an unknown exposure. But the caveat to that is you also have to have a negative flu test. So you have to get a rapid flu to show the flu is not what you have before we would send it to the state lab for testing.
Okay, so they'll test for the flu
Yes,
first.
the rapid test for flu.
And then if it comes back that they don't have the flu, then
You
they
can-
take the next
Yes,
step.
yes.
Right.
So it's not just anybody can walk into an office and get tested for this if they're
should
afraid
not
that they
be.
might have it.
Yes.
And the other thing that I would point out is that there's been a lot of, I think, confusion in the information that's been out there about getting tested and who should get tested. If you don't have any symptoms, if you're not ill, you should not be tested. That
Right.
would not, under any criteria, meet testing.
Okay.
And we have to be careful about that because in public health right now, at least across the state, there are limited amounts of collection kits. There's specific things that need to be in a collection kit. The state lab has sent out, we can order collection kits from the state lab, but they are also very overwhelmed with the amount of stuff coming in
I would imagine
to
so.
get what we need. So we don't want to just test anybody. We want to test people who need to be tested.
And the other piece too is if you are testing somebody that's not symptomatic, that doesn't have symptoms yet, they don't necessarily have enough of the virus where it's going to be swabbed and collected from. Sorry, trying not to be too gross.
No,
No,
in
it's
this
important.
instance, I would think
Yes.
that people would understand.
Yes.
Yeah.
And so the test may come back that it's not COVID-19, and the issue is it was just tested too early.
Okay.
So that is why that guidance is so important.
Yes.
That just if you're worried, if you were in the same city as somebody, but you feel totally well,
Right.
don't rush out to get tested.
Okay.
It really needs to be somebody that has an illness.
And then the next question, since we're talking about those symptoms, is how long does it take to present?
So that's
Do they take the percent? I'm sorry.
No.
That's kind of up in the air as well. It's kind of a range.
So what information we have about what has happened globally and then what's happened with the cases here in the United States that we're aware of. The information that we currently have is 14 days is kind of that outer range. But for most people, the mean is going to be around 3 days. I think I've heard the average maybe 4 to 5 days. So that's really the most likely window if somebody is going to get ill, that they're going to get ill. That's not to say it can't be further out in that 14 days, but that smaller windows where it's much more likely.
And that's how long we're monitoring people if they have had exposures.
I was going to say, we're hearing people in quarantine on the ship. We're hearing people quarantined for 14 days.
And that's where that number comes from.
Yes, that's where it comes from. It's not just a random number. And I would say, can I tell you what the test, how they collect the sample? Would you like to know that?
Would be, I mean
Lisa was demonstrating.
I was trying to be delicate
but
about
I want
it.
people to understand if they meet the criteria and they can be tested, we collect the sample. There's 2 swabs and a sputum culture. So there's a nasopharyngeal swab where they're going to take a Q-tip, and they're going to put it in your nostril until you're far up. They say until your eyes start watering. Probably about a distance from here to here is about the distance they're going to put that up in your nose. I know, I see that face you're making. It's painful. I know, it hurts thinking about it. And the oral swab, if you've ever had a swab for a strep test, that's what the oral swab is like. They're going to do that to get that gag reflex because we want to get a good sample. Just the end of your nose is not going to give me a good sample. If it's residing in your sinuses, I need to get that. And then a sputum culture, we're just going to ask you to cough and try to spit into a sputum.
Can you share whether anyone in New Hanover County is currently being tested?
So there are tests that are going to be conducted because we do have that both parallel processes in place. I would hesitate to say a number. It's something that public health monitors very closely. And there is something called a reporting rule that is in place. And so if anybody is tested for COVID-19 and if there's a positive test, that is to be reported to public health immediately. Because then we have steps that need to be taken and follow up, contact tracing, any notifications that need to be made, and all of those things in place.
And we've been told that if there is a presumptive positive, is what we're hearing.
That's what they're correct.
If one of those is in our community, we will be notified immediately. The public will be notified immediately.
Yes, that will not be a secret.
But just because somebody's being tested here doesn't necessarily mean that the notification will go out.
Exactly.
Correct.
Exactly. And if doctors' offices determine they want to test somebody, they are supposed to let us know. They're sending somebody for testing at a private lab. When that result comes back, if it's negative, we're not going to be notified of that because it's not something we need to follow up on. But we will be notified of all the positives. And like Lisa said, that's when our contact tracing starts, and that's when the process really starts to grow. We have to find out in that 14-day time frame who they've been around. Who they've been close around, and then we start talking to those folks, and it just kind of like a ripple effect. Yes, like a pebble in the pond. Yes.
But there's kind of a whole state public health infrastructure that's put in place for those communications to be happening so that we're all in the loop.
Okay, right now, the hospital today put out added recommendations of no one under the age of 12 and only a certain amount. You folks at the health department have put out some recommendations too, and the state put out some guidance. People over the age of 65, those with underlying health conditions, avoid large groups of people, concerts, conventions, restrict visitors in assisted living facilities, travelers returning from countries and states with COVID-19, follow guidance on self-monitoring. We're hearing a lot of people talk about self-monitoring or self-quarantining. Is that a good idea in your mind?
Yes. And as far as self-monitoring goes, if someone is self-monitoring, they should be taking their temperature twice a day, once in the morning, once in the evening, and do that for 14 days.
And here's the reason for that. So if they're self-monitoring and if they're quarantining themselves, and it turns out that they do start to get sick, you have made public health's job so much easier because you have not been out in public, you haven't potentially exposed to other people, and it's much, much easier for us to wrap our arms around and to make the appropriate communications and to know what the risk is to our community when we have that positive case. So they are doing a huge favor to public health, but also to the rest of their community by going ahead and making those personal sacrifices on their own initially.
And is there a symptom where maybe you should think about self-monitoring? I know if you come back from Washington State, which has been the hardest hit, if you come back from states like California, which have had many cases, if you come back from Italy, you come back from flying overseas in China, I would think if you don't feel well when you come back, that's pretty self-evident. But if I've got a headache, if I've got a sore throat, if I've got a fever for a couple of days, should I self-monitor and kind of stay away from things? Or is there a base level for something like that?
I would say at this point, no.
I mean, you shouldn't be going to work or school or anything. So, so as far as quarantining yourself, yes.
Right.
Yeah, that is a good idea. But I don't think you need to monitor. If you've not had a known exposure,
that's the key, it seems like. If you've been,
Yes, but what we want people to, sorry, go ahead.
And I would say, and that's at this point, because at this point, we don't have any indication that there is a case in New Hanover County.
Yes, that's right.
Brunswick, Pender, Columbus,
Correct.
Baden.
Correct.
All we know of is the 7 cases, the 6 in Wake County and the one in Chatham.
County,
yes.
right.
But I would say, public health, we've been actively monitoring that. Local public health is on weekly calls with state public health for updates, in addition to the numerous communications that happen in between time to share information.
Yes, and to say that this is rapidly evolving is an understatement.
Well, yeah, I can. Yeah,
you know,
I mean,
on a daily basis, we're getting
says,
new information.
You know,
from
when you've
the
got
state.
Dr. Fauci coming out and saying it's going to get worse before it gets better, all you really have to do is look at in China. They notified December 31st, and now middle of March, they're starting to see different outcomes and cases that have run its course and have started to slow down. So if you look at that here in the United States, we've still got a ways to go before that really balloons out.
We're now seeing, for the first time in the last couple of days, we're seeing more newer cases outside of mainland China than in mainland China, and that was kind of a turn.
I think the last thing, to 118,000 confirmed cases, 114 countries, but most of them, 80,000 of the 118 in China, 3,100 deaths of the 4,200. So the vast majority, where it started in Wuhan City and then ballooned out there. As we sit here today, if we would get a positive case, and I hate to do if and worst case scenarios, would things change in what you might recommend to the community?
It would really depend on what the facts of that case were.
Okay.
So I would say, for example, let me give you examples of 2 separate.
And I think that would be great.
Hypothetical cases.
It's not a one-size-fits-all, that's for sure.
Right.
Yeah.
But I think it would be good for people just to have an idea.
So let's say we have somebody that is self-monitoring, has self-quarantined, has been monitoring their symptoms, they returned from Italy, they haven't gone out, they've done all of those things. And they contact public health and they're concerned. We go through the process, there's a test, and they have COVID-19. But we know where they got it, and we know everything they did since they've been in our county. That's one case.
Right.
But I'm not really concerned at that point about the risk to the rest of our community. However, should we have somebody that presents as a single case and we don't know where they got it, they haven't traveled outside of our area, they have been out in the community a lot since they were sick, now that's still one case. But we're going to have different conversations.
Yes.
Understand.
If that's the one case we have, then we're necessarily going to have if we know all of the circumstances around how they got ill.
Gotcha.
And we definitely think, and in that second example, I think about, and granted, anybody can get COVID-19. I think about, what if it's a food service worker or someone who works in a long-term care facility and they weren't feeling well, but they still went to work because they felt like they had to go to work, and they
understand.
Then that is a much bigger issue.
And so those are going to be facts specific to that case that are going to raise our level of concern, but it's still just one case.
It is
yes,
just
exactly.
one and one possibility
yes.
at this point in time. I want to get to some of the questions that folks shared with us on our Facebook page and on our Community Voice page, and we had a ton of them. And I just boiled down to what I think are maybe the ones that I saw more than once or twice. Travis and Kathy Mintz on Facebook, what are the first symptoms you might be aware of? Any thoughts? They may be, as I understand, a lot like flu symptoms.
Just a cold.
ahead,
seems
Fever.
to be one of the first ones to present, although it's not always.
Yeah, fever, and then lower respiratory or upper respiratory type symptoms, the cough, some shortness of breath. If it progresses to difficulty breathing, then it's very serious at that point.
Gotcha.
So that's not going to be the first thing that happens. But the fever, and then the starting, maybe the stuffy head and the coughing.
And again, I would just remind everybody that from what we've seen, 80% of cases
Are
would be
mild.
expected to be very mild.
Right.
A very mild to moderate.
Yes.
So it may kind of feel like a cold, or
Right.
it may kind of feel like the flu. But that range of severity, and not necessarily feel really serious for 80% of the cases.
Gotcha.
It's that 20% that concerns us.
Right. Matt Duggar, is the mortality rate the same as the flu?
No, no, it's not. So an average flu season, I think it's about 0.1%.
Okay, 0.15, something like that.
Right.
Yeah, something.
Yeah, so in that ballpark. What we're seeing here, again, looking at globally and then these first cases in the United States, at first the range looked about like 1 to 2%. We've seen it, if you just do the math on how many cases versus how many deaths have occurred globally, it can look up to as high as 3.4. However,
Right.
I would caution it's not as simple as that for several reasons. So when you have something that is novel and is new, generally the cases that are going to be recognized are going to be the more severe cases.
Okay.
So it's quite possible that globally the number of people that have had it is actually bigger. They just didn't know they had it or weren't recognized because it might have been so mild they never went to the doctor. They never got tested.
And they were not of the at-risk category, so they
Yes.
might have
Right.
sloughed it off as in a couple of days. I kicked it with vitamins and
Yeah,
whatever
they
the
fell
case
into
may
that
be.
80%.
Right.
So
Yes.
until sometime in the future, are we really going to know what that number is? And I would also say that it's also somewhat misleading when you see just a percentage point of what that rate is,
Right.
because that's very dependent on the person that gets sick. So for example, if we have 100 cases, but 100 cases occur in younger, healthy people, it's going to be a very, very
Low mortality rate. Right.
Correct. But if you have a circumstance like you saw what happened in Washington State, where they had an outbreak in a long-term care
Right.
facility, that has a very high fatality
Yeah.
rate.
Yes.
It's really kind of where it hits and who it hits.
Exactly. And you think about China has the majority of deaths. So if you take the mortality rate in China, that is going to be much more significant than the mortality rate of the countries outside of China.
Outside of China
Yes.
with 114
Yes.
and
Yes.
cases and 1,000 deaths, each one of them terrible, but
Yes.
when you compare 3,000 to just in China to the 1,000
Right.
outside.
in the other
It's much
113
different.
countries.
And I
Right.
think that's why you've seen such an amplification of those protective measures in the last few days when we're talking specifically about those groups that are at higher risk of severe disease. It's going to be really important if this becomes an issue in our community that's impacting us. We want to try to keep as few people from getting it as possible, but it's really important that we keep certain people from getting it.
Understand. Once again, if you are just joining us, Lisa Brown, the New Hanover County Public Health Preparedness Coordinator, and Carla Turner, the New Hanover County Public Health Personal Health Services Manager, joining us. A special edition of the One-on-One with John Evans podcast, a real deep dive into the coronavirus, trying to separate myth from fact, fiction from fact, getting a lot of your questions answered here today. Lindsay Miller and Becky Bowers-Namarga both had something along the lines of how contagious is the virus during the incubation period? Does it matter?
Well, I think that is something that the knowledge is still evolving
Yes.
on too.
Okay.
We don't know.
So we're going to try to be protective, and we're going to try to limit folks being out if they're at risk during that incubation period.
Right.
Because while we think it's possible, we think the risk is probably much lower of being infectious during that incubation period. And
Yes.
part of it just simply comes down to the symptoms. So if somebody is coughing and sneezing, they are expelling
Right.
the droplets. Those germs are going out and are much easier for other people to then come in contact with, versus if you're not coughing and you're not seizing.
But I got a fever and,
just stuffy
and a
head,
headache,
you just don't
and
feel
stuffy
good.
head.
Yeah.
It's not impossible that you could make somebody sick, but the opportunity is just going to be so much lower.
For
Understand.
exposure, exactly.
Yeah, and a lot of these questions are, like you said before, I think the interesting thing you said is we're not going to know a lot until afterwards.
Unfortunately.
And that is unfortunate to those who have so many questions and are concerned right
Yes.
now. Debbie Springstead, can you get it more than once? If you get it and you get over it, can you get it again?
So that is also something that knowledge is going to be evolving on. So what I have heard is that what they would expect is that this would behave like other coronaviruses that they're familiar with. So the thought process would be you should have some
immunity.
level of immunity.
Yes.
However, just
is it
like
enough?
the
Exactly.
flu, you could get the flu more than once.
Some
Yes.
people do.
To get it
Because
twice
the
in a season.
strain that you get might be different. So I would be hesitant to say that it's going to be impossible, especially if this is with us for a long time, that there could not be some subtle mutation in the strain that then somebody could get again later. So the science on that, it's still evolving.
Right.
We only have 10 weeks of data right now, since the 31st of December. So
You only have 2.5 months of evidence, really.
Correct.
At this point in time.
Yes.
Becky Broussard-Stitch, and I think we may have talked about this, where can someone go to get tested?
Well, we talked about first of all, if you're not feeling well, you need to call your healthcare provider before
Call
you just
your
show up.
healthcare
Call your
provider
healthcare provider.
first.
That'd be the first thing I would recommend. If you meet one of the two criteria, your healthcare provider, people can call the health department and tell us what their symptoms are. And if they're trying to meet,
Let's go over those one more time for those who may have just come in.
The first criteria for testing is fever or signs and symptoms of lower respiratory illness, and that's cough and shortness of breath. So that's either of those. But along with that, a confirmed contact to a positive. A close contact to somebody who's been positively confirmed.
Gotcha.
The other criteria that you could meet is that you have fever and signs and symptoms. So you have the fever and the lower respiratory, and you don't have a known exposure.
All right.
So
But you
either
have the
one of
negative
those.
flu
Yes, thank you.
test.
But you also have to. The first thing the doctor's office needs to do is you need to have a negative flu test done, and the rapid flu takes 15 minutes. We do not do flu tests at the health department, so you need to go to your healthcare provider to receive that.
All right.
And part of the reason behind that is, we are still in flu season, and
Yes.
the flu is widely circulating still. So
Definitely.
it's still much more likely that you have the flu.
And that's what, when you're talking about separating this from the flu and COVID-19, they're both viruses. They
Exactly.
both present some of the same symptoms, but it all depends. A different strain, and unfortunately, you have to peel back some layers of the onion to find out
Right.
what it is that they have.
Yeah.
So if they meet either of those two criteria, if they want to know how to be tested, their care provider can determine that they're going to collect the sample, and they can send that to a private lab. Or if they want to call the health department and tell us their symptoms, and when we can confirm that, like if they say I had a rapid flu test, I'm going to need to know your doctor's office so I can call and confirm that your flu test was negative.
Okay.
Then we can actually go to that person and collect the sample and take that through the state lab. But they have to meet one of these two criteria for us to send a sample to the state lab.
That's perfect. Rebecca Applewhite Hester, how does the virus affect newborns? Are they at a higher risk?
So again, this is something that there's limited data on, but I believe what they had seen in some cases in China is that newborns seem to do very well. As
And
far as
children overall
recovering.
apparently have done well from what I've been reading.
Right.
Yes, they have much higher recovery rate than the 65 and older
The
population.
CDC has issued some guidance for pregnant women because there might be some concern that it could possibly impact an early delivery.
Yes.
But I think what they've seen so far, and again, I'd caution everybody that
Understand.
that is so
this
far.
This is not painting with a wide brush here.
Is that newborns tend to do very well from those that had been observed that had gotten it in China.
And knowing that newborns are also born with a little bit of their mother's immunity going on, and if they're breastfed, they're going to still continue to have a little bit of that continued mother's immunity while they're being breastfed.
And one of the things when
develops.
you talk about, at least when we've been reporting, the at-risk population in this is those over 65, those who have the presenting health conditions like diabetes, heart disease, some of the others. But we don't see the young population being at risk for this like we might normally see and like we've done for the flu.
Right.
So there is
Yes.
a difference in those who
Valid
are
point.
considered at risk for this already.
Yes,
Correct.
children are not at high risk unless they are children with special health care needs.
Right.
They would potentially be at risk. But a typical child, no, they're not in the risk category.
Understand. Myra Jose Sarmiento, I'm traveling out of the country next week. When I fly back into the country through RDU, what procedures will they be doing, if any?
I'm going to say, it depends on maybe where she's going and where she's coming back from.
Yeah,
Okay.
and I would caution her too, because it's subject to change very quickly.
Yes.
Okay.
So the information that you have today may not necessarily be what's accurate when you return.
Yes.
I would caution her to go ahead and look at the CDC site for any travel advisories.
CDC.gov.
Yes.
Yes. There will be a listing of travel advisories. I believe there's also guidance specifically for travelers, but I would have her go ahead and look at that site and check that regularly so that she feels fully informed with the best information before traveling.
And just again, from doing the reading and the research that I have, if you're traveling to Italy, if you're traveling to Korea, if you're traveling to China, if you're traveling to Washington State, it's a different story than if you're traveling to Ohio or Michigan or Pennsylvania. Am I correct?
And again, but this is evolving
Today,
so quickly.
yes, right now.
Today, as we sit here.
yes.
The other thing that I would caution when we're talking about traveling is that somebody that is in a lower risk category for severe complications might take a look at what their personal risk of traveling is a little differently than somebody that is going to fall into one of those higher risk categories.
Right.
So I would recommend that they may reconsider travel and may think about this a little bit differently than if
they're
you're
in
not
that over 65 or
definitely.
Gotcha.
And I would say almost every day additional states reporting cases. Louisiana and Ohio just reported their first cases of COVID-19.
Okay,
Yes,
so we have, again, things are
rapidly evolving.
rapidly
I know we keep
evolving
saying that.
as
but
we
it's-
sit here
yeah.
today and tape this.
Correct.
Pam Williams asked, what about cleaning a beach house after a rental?
Well, right now, that's a really good question. CDC guidance is you just do your regular routine cleaning, but you pay extra close attention to high-touch areas. Doorknobs, stair rails, handrails, countertops, that type of thing. You can buy the products you buy in the grocery store or Target or wherever to clean. It should say on the label, kills human coronavirus. Am I right on that, Lisa?
So, well, the
It
thing
does,
is,
it does on the Clorox wipes, because
And
a
if-
lot of people have pointed that out.
and what that means is that's not been tested for this
This
particular
one,
coronavirus.
but all the other ones it does.
But all the
yes.
other ones.
Yeah, the other 6, it does take care of
And
those.
so we assume
Yeah.
that that would also be
Yes.
applicable in this case.
Okay.
So,
But
if
again,
they wanted to do a deeper clean, I would certainly encourage that. There's no guidance that says they need to do that now. Just a normal
Understand.
clean with disinfectants that kill the human coronavirus is what I would advise.
But I think that's very wise to be thinking
Sure,
that.
yeah,
too.
that's a really, especially
yeah,
as
I mean,
beach season
it's
comes up. As
middle of March.
Yes,
Yeah.
oh, it's going to
and
start
this
after
is
Easter.
likely going
Yeah.
to be with us for a little while longer. So,
Yes.
Emily Ware Griffith, I have friends flying in from Asia. Will we need to self-quarantine when they arrive?
Oh, I wonder where in Asia they're flying in from.
And if the travel restrictions might change those plans.
That is
And I don't know,
possible.
and if she's asking if she herself who lives here would need to self-quarantine, I mean, she's not been exposed. If these people are coming to stay at her home,
Okay.
I think that's a different story. Would you agree?
I would caution them about.
Having them come into the, that's a good
I
question.
would be.
I know we're not telling her to call her
No,
friends
we are
coming
not.
in, but you have
make
to
an
know.
informed decision.
And I guess,
yes.
and the other thing is, maybe I should back up. If somebody has a specific question like that, I would ask them to reach out to us.
Sure.
So that we could talk through, because it really is going to be somewhat dependent upon where they're coming from and the specific factors, and maybe just having a conversation would help versus.
Okay, give us a phone number where they can
I was
call
going to
over at the health
say,
department.
if they want to call us at Public Health, it's 910-798-3500.
Okay.
That's the Health and Human Services phone number.
Right.
The first thing that comes on the message is if you have questions about coronavirus, also called COVID-19, hit pound. You're going to hit pound, and it's going to give you 2 options. If you have general questions, you hit pound again. That's going to send them to the state's hotline. That's qualified subject matter experts answering the phone that can answer all those questions.
Okay.
So if they are symptomatic, there's another extension they hit to actually talk to one of our community health nurses.
Understand.
But if it's a general question,
they
we
should
need them
seek
going
as
to the
much
state.
information
Yes,
as possible at
and
this
it's
point.
out there, John. I mean, go to the North Carolina DHHS website, go to the CDC website.
Yeah.
There is, yes,
But
an
we
amazing
definitely
amount of
understand, and
information.
that's part of why the state set up
Sure.
that hotline, is that with something changing this quickly and rapidly evolving, it's almost information overload. There's so much coming at you at one time.
Yeah.
And so sometimes it's reassuring to be able to talk to a live person.
Yes.
It is.
And hear
I would
a
feel
voice.
better.
Have somebody tell you, not just
agree.
read it, but
I
have someone
understand.
tell you. Yes.
Well, look
and-
at how many questions we've had today that could go one way or the other. And it's tough to
Right.
get that, A, in an email, B, in a recording.
Yes.
It's
yes.
difficult to get that. Now, I know that, you folks are probably under the strain of having so many phone calls, but like you're right, though. I would agree. Having a living, breathing human being
That can
to
answer
bounce
that.
that
And we
stuff
could
off
probably
of.
find that state number too and give that number directly as
Yep.
well.
We can get that.
Yes,
we can get
I've
that
got- yes,
and give
I'm
it up.
sure it's in the guide somewhere.
Stacy Spivey, should we avoid hospitals unless we're sick?
I would. You mean as far as visiting, if they feel
That's
well?
what my guess would be. Yes.
Okay.
I would, if you're sick, no, I would think if they have someone in the hospital and they themselves feel well and have not been around anyone who doesn't feel well, I don't think there's any problem with visiting a hospital or a long-term care facility. And if you don't mind me leading in and thinking about long-term care facilities from this, one of the things we don't want to happen is social isolation of these people who are residents in these long-term care facilities. All of a sudden their families can't come see them.
Understand.
So that's something we worry about too, because again, this is the 65 and over population. You worry about social isolation with them anyway.
Right.
And now we're adding another caveat to that.
I would say though, you might want to contact and make sure they might be putting some restrictions in place as to how many visitors are appropriate at one time.
Yes.
I think New Hanover today
like
came out with two.
Two.
is the
Okay, I
most
was
they
going to
can
say
have.
I heard they had
Yes.
reduced the number.
Right.
Yeah.
So there may be some of those things that they need to be aware of and work around. The other thing that I would point out, since you brought up the long-term care facility,
You're welcome.
is if you have a loved one that is in one of those facilities, social isolation is something that we are worried about. If they have the ability to do some of those technological communication
FaceTime or
pieces,
Skype.
FaceTime.
now would be a great time to make sure that they know how to use that and get them comfortable with doing that, so that if
a great
there
idea.
are some issues, you guys have already kind of worked through that.
Yeah.
Yeah, that's a great idea. I hadn't even thought about that.
I can't come
Yeah.
see you, but I can still see you.
Yeah.
We can still talk and see each other. Yeah.
Connie Plettle said, although there's no vaccine for COVID-19, do you think people who received this year's flu shot have at least a little bit of protection? I have seen this question an awful lot.
I would say no.
No.
The flu virus is not, influenza is not coronavirus.
As much as I would love to say
I wish.
yes, the
Yes.
answer is no.
No.
Gotcha. Christina Brooke Radford, how will this affect teenagers with asthma? Or anybody with asthma, really?
Well, that's not, well, I mean, that is a chronic respiratory condition. It's not a chronic lung disease. That's a good question. I don't think we've seen any information that specifically identifies asthma as a risk category. It just says chronic long-term health conditions.
But you're talking here, though, as one of the symptoms to possibly
Right.
get tested is
Yes,
respiratory,
Correct.
issues. So they may be suffering a little worse than they normally might at this point in time.
Good point. Yes.
Okay.
I would encourage them to be
Yes.
very self-aware of what their
Yes.
normal is, and if it doesn't feel like they're normal, to reach out to their healthcare
If they're-
provider to make that
Yeah.
call.
If their inhaler is
call.
not helping them like it usually does, I would certainly call my care provider.
Good call.
good
Susan
question.
Peterson, I just touched my face. What
We're going to count how many times you do that.
I know it. What meds should we have on hand to try to fight the symptoms?
Great question.
Well, there's no medical treatment right now that we have been informed of that treats coronavirus.
Right.
But you can certainly treat your symptoms as far as fever-reducing medications and that type of thing, just to treat those things. Staying hydrated, trying to make sure you drink plenty of fluids because that loosens up. What do you think? What would you add to that?
I would add to that the same things that you would want to make sure you have on hand if you got the flu or if you had a bad cold. So those fever reducers.
Maybe something that helps with the
Sinus
cough and
medications,
yeah,
whatever
I
you
think
can take
Mucinex,
safely.
anything, sure,
Right.
for anything for congestion and that type of thing.
Understand.
That's a
Good
really
question, Susan. Thanks.
That is.
Yeah.
Yeah.
Tasha, will hand sanitizer help keep you from getting the virus?
Well, it's definitely a good
Yes.
precaution to take.
Okay.
So hand washing with soap and water, doing it
Is the best.
correctly.
20 seconds.
Yes.
20 seconds and really getting in there. There's lots of videos online that people can watch.
Songs you can sing.
I just sing happy birthday at the top of my
yeah.
lungs in the staff bathroom. Yeah.
That is
Twice.
perfectly adequate. If you can't wash your hands, hand sanitizer is a good idea. I would just say for my own personal preparedness, I keep a small little bottle
Sure.
in my purse so that if I did touch a doorknob in a public place or something, I might use it if I have, just, it's not a bad thing.
Understand.
It's better than nothing, and it does with a certain amount. Is it 70%? alcohol, 60% alcohol it has to have in it.
I think it's a minimum of 60.
Minimum of 60 is supposed to do the trick. But, and I will say, I actually got a really good question from someone, do they need to buy antimicrobial soap as opposed to antibacterial soap? And after I did some research with the CDC, the answer is it doesn't matter what kind of soap, because what's doing it is the 20 seconds of friction. It's pulling the germs off your hands and you're rinsing them down the sink. It's not that it's killing them. You're removing the germs from your hands. So whatever kind of soap you have, wash them for 20 seconds at least.
It doesn't matter.
Yes.
I'm going to add an extra 30 minutes to this. Should have. Let's go. Michelle Huffam. Is testing a patient who exhibits symptoms optional, or are doctors obligated to report the findings if they get positive?
Yes.
Oh, they are required to report the findings.
Reportable disease to the state of North Carolina, which means the physician's office is reporting to us at the health department, and we are then calling the state and letting them know we have a positive case. And then we're starting our contact tracing from there. Yes.
Debbie Sweeney, what do you mean by underlying medical conditions? I think we've gone over this, but let's go over it again.
Chronic, long-term health conditions, well, chronic and long-term are the same thing. Chronic health conditions, diabetes, specifically the CDC points out diabetes, heart disease, and lung disease. Those are the three that they actually name.
And for children, those children with special needs.
Special health care needs, children with special needs, yes.
So,
want to keep an eye on
anybody
them.
that is immune compromised.
Yes, exactly. Like we talked about people who have chemotherapy, or there are some medications for rheumatoid arthritis that
suppress the
immune system, so those types of things.
Those are the serious questions. I mean, I got a question like, can you get this from drinking Corona beer? I mean, really. I didn't even want to bring that up, except to give us a little
Unless, of course,
bit
you're drinking
chuckle.
after someone who's symptomatic with a fever, then you want to think
twice.
Don't share it.
Corona beer with somebody that
who's
is sick.
symptomatic.
Understand.
Yes.
What didn't I ask you that people that you've been getting questions about that you want to make sure? Because I'm sure that you've been asked every question under the sun in the last month or so.
I think masks, that's a big one.
Oh, that's a good one. Okay. Masks. Do they help?
Masks. I thought you said masks. I'm like, well, okay, no.
Masks.
Masks. Okay, that's a great question. Okay, if I'm putting first of all, what we in healthcare would be using if we were taking care of someone who potentially had coronavirus is what we call an N95 mask, which means it keeps out 95% of the germs. It is a mask that has to be fit tested. You can't just go buy one at the store and pop it on.
You can buy N95 masks.
But you shouldn't do it and just pop them on.
But if you're wearing it and you're not properly fit tested, you might have a false sense of security as to how much protection it actually offers you.
Yes.
Okay.
Now, when someone walks into, I know if I've taken my child to the doctor's office and she has a cough, the first thing they do is put a mask on her face. And that's not so much to protect her from getting something from anybody else, it's to protect everybody else from what she's coughing. So a surgical mask is not necessarily going to keep anything that you maybe have from my face if I'm wearing the mask, but if I'm coughing and sneezing, it's going to keep all my stuff inside. I'm protecting you by putting that mask on.
I think that's accurate. And I've heard, and I've been in discussions with family members that have somewhat disagreed or had concern with the fact that the guidance from the CDC is that everybody doesn't need to go around wearing a mask right now. Mm-hmm. And I think that we may not have done a great job explaining why that is. So if you put a mask on, so you go and you buy your N95 mask and it's not been properly fit tested, but you're wearing it anyway. Okay. Those things are hot, they're irritating, they move around a lot.
Yes.
It's annoying. Mm-hmm. Now, if you're already touching your face too many times normally, how many times do you think you're going to touch your face to readjust that mask? And you might have touched the table or another surface, and now you've adjusted that mask by your nose right up in your eye, and
where you don't want to touch.
Have contaminated yourself. So you thought that mask was protecting you, but because of how you were wearing that mask and your uncomfortability with that mask, you've actually accidentally made yourself more vulnerable.
Yes.
Gotcha. And we have seen people do everything. We've had people, make a run on toilet paper.
I'm still trying to figure that out.
I think I understand that.
Explain.
Okay. Well, we're telling people to be prepared, to
stay
make
home.
a kit.
That's true.
If
we are.
you can't leave. So what is something that you don't want to run out of if you're
Valid
going to be
point.
at home for
Valid
a while?
point for 2 weeks.
Well, toilet paper.
Yeah,
now, maybe people are going a little overboard for clearing the shelves. But I absolutely
It's too funny.
understand
You're right. It's
why
exactly
they want to
right.
put toilet paper in their kit. So
So
I think that's what's going on.
So it's a necessary supply if you're going to be quarantined. You just don't need to be
hoarding
buying
it right
it up
now.
like you
need
might
enough
water
to-
before hurricane
Like it's the
season.
zombie
You
apocalypse.
don't need enough to
yes.
supply your entire neighborhood for a month. Leave some for somebody else.
Understand.
Exactly.
What else did I not ask you about?
Oh gosh. You did
What are the
great.
top questions you've been
Covered a
getting?
lot of you've hit on.
Yes,
Okay.
a lot of the
Much.
questions we get is, can I be tested? What do I have to do to be tested? We get a lot of parents who are maybe a little concerned about sending their kids to school.
Oh, yeah.
Trust me, if there's something going on in the school system's going to be on top of that, and they're going to be communicating with us, and we're going to be working with them as far as helping them get information out. Kate and our other communications people can certainly be a resource for the school system.
So along with the public being notified that there is a presumptive positive case here, we will likely, after that happens, then start to see some of these other decisions being made, again, depending on where the case was, depending
be
on
the
what else
trigger
has
that
happened.
makes us
but
have to do some
likely
things,
not
yes.
going to have those kind of things happen unless a presumptive positive shows up.
I would find that very unlikely.
Yes.
Okay.
Yeah.
And I would say that the schools have been very proactive and very
Yes,
engaged.
they're doing a great job.
They're one of our regular planning partners anyway, and they have a team member that's actively engaged with all of our plans as a county, as a region. So that hasn't
I agree.
changed just because we're talking about COVID-19 versus a hurricane. And we're in very frequent communication about a whole range of
All
topics.
kinds of scenarios that come up,
And
yes.
in New Hanover County, we are very fortunate in that our school nurses are actually public health employees. So
Yes, and we have one in every
So
school.
they're front line.
Yes, yes, they are
with
getting the
this.
same information that when we get information from the CDC or from the state, we are pushing it out to all of our public health employees.
Right.
All my school nurses are getting that. They are a source of information for their administrators in their school. Like you say, the school system central office has been great in communicating with us because they just want to make sure they're doing the right thing. And I totally
Yes.
respect that and appreciate it.
And I guess over a week ago now, maybe 2 weeks, we're losing track of
Yeah, don't know
which
what
week
day
is
it
which.
is. Yeah. Okay.
But the Board of Education actually had us come
Yes,
speak
that was last Tuesday evening.
and
you
present
spoke
at
there.
the board meeting because they wanted to be proactive. They wanted to already have that conversation, the board level, aside from those staff that we were already directly engaged with.
So we appreciate that from the top down. We
Yes.
appreciate the board being proactive in that as well.
As people are seeing things be canceled, they're now talking about an NBA team in California playing without fans.
nobody in the crowd,
There
yeah.
are concerts being postponed. There are events being pushed back. Should that concern anyone in southeastern North Carolina that those steps are being taken in California, in Washington State, and in some of the other places where there are more cases reported?
Well, I think those are things that we're going to be constantly watching what's happening
Maybe exploring.
it across the country, in our region. Unfortunately, viruses don't pay attention to jurisdictional boundaries or county lines. or
County lines
bridges.
do not stop them, exactly.
And
Yes.
unfortunately, we have the benefit of seeing what other areas have gone through first
Right.
and seeing
Yes.
what works to help them slow transmission and have the benefit of getting to learn from that. And unfortunately, what some of them have seen is when they've had that first case, they may have found out at that time that that first case was one that really worried them. And they may have had more transmission happening in their community, and so they needed to elevate quickly, which is why we've already been making those messages about, events could be canceled with very
Right.
little notice, and getting everybody used to thinking about this
Right.
so that hopefully we don't catch anybody off guard if we need to take further steps.
And it wouldn't
Go ahead,
be just to
Carla.
be an inconvenience. We're not trying to make anything inconvenient for anybody. We're trying to protect the community as a whole. And sometimes you have to make tough decisions.
And I would say that this is a whole community effort. All of our different agencies.
Public health cannot do this
our
alone.
organizations, our leadership, everybody is actively engaged, monitoring this and on top of it. So
It's very encouraging.
nothing
yes.
is going to happen in a vacuum.
And
Yes.
but the other side of the coin is live your life.
Yes,
don't
don't hunker
saying-
down in your house if there's nothing wrong with you, and we have no
Right.
positive cases in the community. Continue to appreciate the day for the gift that it is. Yes.
Yeah.
But again, though, I would caution everybody, if you're in that higher risk category, you're going to need to take some steps now.
In a high risk category again, the governor's office and DHH Secretary Cohen said, and you guys have put this out, People over the age of 65, those with underlying health conditions should avoid large groups of people as much as possible. Underlying health conditions, diabetes, smokers, lung disease, children with special needs fall into that category as well. Those are the people that need to be at least more aware of what they're doing right now than somebody who's 45 and healthy or 35 and healthy and doesn't and has had the flu and all this other. It really depends on your case.
It does. However, I would say that it's going to be dependent on those of us in the lower risk categories, that if we get sick, we need to take ourselves out of the possible transmission chain. We need to stay home from work. We need to self-isolate, because even though it's not likely, and we can never say without a fact, but it's not likely that if I get it, that I'm going to have severe complications, the person that I accidentally give it to might.
Exactly.
And so it's going to be dependent upon the whole community to keep everybody safe.
Okay.
And I'm sorry, John. I will say that as far as guidance for the special populations, again, the CDC, and it is a lot of information, they've got guidance for schools K through 12, colleges and universities. They've got guidance for those at higher risk, specifically for that. They have guidances for businesses and employers, because businesses now need to be thinking about what they're going to do if they have their employees who are sick and unable to come into work.
Right. And again, we've harped on this, and I've harped on this on my Facebook page and social media. Go to trusted websites for information.
Thank you. Oh, thank you.
There are so many sites out there that, and we laughed and giggled at the Corona beer and everything else, but there are sites out there that are putting stuff out there that is really just not confirmed and not tested. CDC.gov is at the top of the list. Everything you want to know. WHO, the World Health Organization, .int. That's another one on the global scale. We have a special part of WECT.com in our mobile news app where we have everything that comes in on coronavirus. We have it there. You all have a special section in the New Hanover County Public Health Department.
NHCGOV.com has a great tab you can click on to get the information.
And another thing I would point out is that right now, in a situation like this, when people are concerned, and it is so easy to spread false information, is when those with not so great motives can take advantage. So look out for that clickbait, because this is a prime opportunity to hide a virus that is not
computer virus, a different kind of virus.
Exactly. This is unfortunately exactly the type of situation that bad actors would be looking to take advantage of.
And we've seen that. We've seen that throughout the country.
Let's not fall victim to that.
Okay. Once again, let's go over them again. The prevention steps: wash your hands frequently. Carly, you said it doesn't matter what kind of soap, antibacterial, antimicrobial. They're all good.
Yes, the scrubbing of 20 seconds, yes.
Okay. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick, not feeling well. If you don't feel well, A, stay home like you all have said.
Please.
But B, tell people, hey, don't shake my hand.
Right.
Exactly, exactly.
Yeah, again, it would be a good thing. Cover your mouth and your nose with a tissue when you cough or you sneeze. Do not reuse a tissue after you cough or a sneeze or blow your nose. Right into the garbage can. Clean and disinfect surfaces that are frequently touched. Phones, doorknobs, desks where you do interviews, mouse.
We signed in with our own pens up front. We said, if you don't mind, let me just get my pen out of my purse to sign in.
I understand. That's
But
a great point.
we've offered guidance to maybe like local restaurants, cleaning your menus, anything that businesses give out to the public, to multiple people. Pay extra attention to that and clean them. I mean, those are things we should do during flu season anyway. But right now, let's go ahead and put those in practice.
And like you said recently at a presentation, was through public health, through environmental health services, we inspect restaurants, but that's really, like you say, kind of in the back of the restaurant. The kitchen, the storage, the refrigeration, that type of thing. As far as out front, that's not something that falls under state regulations. So there's really those things that you might not think about. Like you said, like when we went out to eat last night, when they brought me the tab, I shook their pen off and pulled my daughter thought I'd lost my mind. I'm like, no, I can't use his pen. He's a very nice man. I'm going to use my own pen to sign this receipt.
But we're seeing lots of businesses are already putting those things in place and taking a look at their processes and figuring out what is unique to them that they need to pay more attention to.
Well, Carla Turner, the New Hanover County Public Health Personal Health Services Manager, thank you for coming in today so much. I appreciate it. Lisa Brown, you have been on every media channel in southeastern North Carolina from the New Hanover County Public Health Preparedness Coordinator. I really, truly appreciate you taking the time today. It's been very enlightening. I've seen a lot of this stuff, but even today, some of this material, I learned something new today from all of this stuff.
Well, we really appreciate you taking the time and helping get these messages out.
Yes, and I appreciate that you solicited questions from the public because we need to know what they'd like to know.
cdc.gov, wect.com, nhc.gov.
gov.com.
Yep, all of this material. Find it, know it, and at least read about it as far as keeping yourself healthy. Carla and Lisa, thanks again for being with us. We appreciate it. I'm John Evans. Thanks so much for joining us for this special edition of One on One.